Hello everyone, I am Dr. Jayendra Yadav. I am a consultant neurologist practicing at Fortis Hospital Vashi. Today I am going to discuss about very important disease called stroke. Stroke is a medical emergency and if not treated well, it can lead to a long-term disability. So what is stroke? Stroke is sudden neurological damage because of the vascular reasons. So blood vessels can either get occluded because of the clot formation inside the blood vessels, or the blood vessel may rupture and that leads to the hemorrhage. So these are the two important types of stroke: ischemic stroke because of the blood clotting inside the blood vessel, and hemorrhagic stroke because of the blood vessel ruptures, which leads to the bleeding inside the brain. So among these two type of stroke, the most common stroke is a ischemic stroke, and almost 85% of strokes are because of the blood clotting inside the blood vessels, and the rest 10-15% are because of the blood vessel rupture leading to a hemorrhage. So unless we do an CT scan or MRI, we will not know what type of stroke it is, whether it's a ischemic stroke or a hemorrhagic stroke. The stroke usually present with the sudden onset symptoms like balance problem, vision problem, double vision, visual blurring, facial asymmetry, face drooping, sensory loss in one side of the arm or leg, or speech difficulty. If somebody experience any of these symptoms which are sudden onset, especially those who have risk factors for the stroke like hypertension, diabetes, cholesterol problems, addiction, they should visit immediately a stroke ready hospital. So as I said, there are two types of stroke, either ischemic stroke or a hemorrhagic stroke. Ischemic stroke is because of the blood vessels occlusion, because of the blood clot. That will differentiate him based on CT and MRI imaging. So once we know that a person is suffering from a ischemic stroke, and suppose this patient presents to us within first 4.5 hours, that is called as the window period, we can administer a drug called as a thrombolytic drug. The commonest drug used are alteplase and tenecteplase, and what these drugs do, they lead to a clot lysis, and because of the clot lysis, the occluded blood vessel will reopen and the blood flow can be re-established, which can lead to a early neurological improvement in a patient with a stroke. So all this is possible only if person visits to a stroke ready hospital. Okay, if somebody visits to some other hospital where facility of emergency department, MRI, CT facility, neurologist or neurosurgeon facility is not available, then it may take time and we may lose a time to administer these thrombolytic clot busting injections, which may be very life saving in patient with an acute stroke. So if it's a stroke patient should visit stroke ready hospital. Those living in the vicinity of Vashi, they should visit to a Fortis Hospital Vashi if there is a suspected stroke patient. Thank you.